Hi, welcome back to my channel. So I thought I would do a video about things not to say to a cancer patient or a cancer survivor. So for those of you that don't know my story, I was diagnosed with stage 3 triple negative breast cancer in August 2017 at the age of 34. I had 6 rounds of chemo plus a double mastectomy because I found out that I carried the BRCA1 genetic mutation, which meant that I was at a risk of 85% chance of having breast cancer again. I've also got a 60% chance of getting ovarian cancer. It's just the gift that just keeps giving. But when I was going through my treatment, I had 6 months of treatment, there were a number of things that kept coming up that people were saying to me that aren't the best thing to say to someone who is going through cancer treatment or who is a cancer survivor. So I thought I would make this video just for anybody that was curious about maybe what not to say to a cancer patient. So the top comment not to make to a cancer patient or a cancer survivor, saying, oh yeah, my aunt, uncle, grandma, friend, colleague had that cancer, and then proceeding to tell them how that person had died of cancer. So sounds like a pretty common sense thing not to say, but you will be very surprised at how many times I must have heard that. I think I must have heard that 20 times in the process of going through my cancer treatment. Cancer is very, very scary. It's probably the scariest thing I think anyone would have to face. Any sort of chronic, potentially terminal illness will create a lot of fear in someone. And the treatment itself is very, very aggressive, and it is hard to go through it. So the person that has cancer needs support, guidance, love, respect, and reminding them that there is an element of fatality, I suppose, is not a good thing to do. They will already be incredibly aware of their own mortality. They will know that potentially their cancer could become terminal. And they are aware that a lot of people die of cancer. So having a reminder in conversation is not a good thing to do. And everybody's cancer is very, very different. So people that are stage 2 can go on to develop into stage 4 metastatic cancer, which is terminal. People that are late stage 3 can beat it and stay cancer free for the rest of their lives. So it really isn't a one size fits all. I know someone that died of testicular cancer, I know someone that died of breast cancer. You know, there are people that happens to, and it's very sad, but that person does not need to hear that during their treatment. The second comment not to make, and again, I heard this quite often when I was going through my treatment. Oh, breast cancer, that's a good one to have. Let me tell you, there are no good cancers to have. Cancer is cancer. It is shit. It has the potential to kill you, okay? Some cancers have higher success rates in terms of responding to treatments. Breast cancer, when caught early, does have a high success rate in treatment. But there are many, many different types of breast cancer, and I don't think people are aware of this. There are many different types of all sorts of different cancers, but breast cancer especially, because there are 3 hormones that breast cancer can be receptive to or not receptive to, and depending on which ones are affected will depend on their success rate. So my cancer was triple negative, which means that it won't respond to any of the hormones, which makes it very difficult to treat, which means that the success rate for treatment with my cancer is very different to, say, someone that has a progesterone positive cancer. And you don't know what stage their cancer is, you don't know in terms of like how their body's going to respond to certain treatments, you don't know what their treatment is, so there are no good cancers to have. The third thing that I heard a lot, and I know it comes from a good place with people, is the whole "you're an inspiration" quote. Now, it's always nice to hear that, and I know people are trying to say it in a positive way, and that they admire my resilience and my ability to go through my treatment. However, and it comes hand in hand with sort of the whole "you're so brave" thing, I don't think it's about being brave or being an inspiration. You are given the treatment plan and you follow it, because the alternative, if you don't, is that your cancer will kill you. So you don't have a choice in this. You aren't choosing to go through this treatment and being brave. You are just doing what you need to do to stay alive. And it's shit. The treatment is horrible, but you got to do it. So you don't have a choice. Now, the fourth comment, again, I got this comment quite often, is the whole, have you tried insert supplement, food product, diet, certain exercise, I don't know. Have you tried something else to get rid of your cancer? That was the one that really actually used to piss me off quite a lot because I've chosen my treatment path. I'm going with modern medicine. I've chosen to go through chemotherapy. I don't need to hear about some wonder product that you've seen on Amazon, some CBD oil that's supposed to get rid of it, some medicine that someone's created that's supposed to get rid of cancer. I don't want to hear it. I've chosen my treatment path and I would rather not hear those theories. And I know quite a few cancer patients that really is a bit of a bugbear for people. So don't say that, okay? It's also like the whole diet thing. I think diets are very personal. And I know there is a bit of research into things like sugar-free, meat-free, dairy-free diets that have improved quality of life in terms of cancer patients. And I know there is a lot of research that says that cancer does feed on sugar. So anything that's sort of a high sugar diets aren't recommended. However, when I was on chemo, and when lots of people are on chemo, it's difficult to eat because of the nausea, the sickness, the diarrhea, the constipation, the mouth ulcers, the heartburn, the acid reflux. All of these things, your day-to-day quality of life is already compromised just going through treatment. And I know my steroids, I was craving carbs, I was craving sugar. I know that's a common occurrence when you're taking steroids, but also I just wanted to eat things that wouldn't make me feel sick. So if that was fish and chips from the chip shop, that was what I was going to eat. If it was sweets or chocolate, that's what I'm going to eat. I don't want to restrict my diet, and I don't want people discussing my diet. I think that was the one thing that annoyed me when I was going through cancer. It's almost like your body is open to discussion. Your body and your lifestyle are open to discussion. I would quite often, if I went down the pub and I had maybe one glass of wine, I would quite often have people come up to me and say, do you think you should be drinking that? Well, the worst has already happened. I've already got cancer. I can't get any sicker. So there is that kind of, at the back of your mind, these might be the last few years of my life. Am I going to restrict myself, or am I just going to embrace the day and just enjoy it and get on with it? So I chose to embrace the day and enjoy every day as I could. So just be careful about what you're saying to people, especially when they're going through treatment. So on the flip side, I've done all the negatives of what not to say to someone with cancer. What should you say to a friend, a family member, a colleague who is going through cancer treatment? I think you just need to be a sounding board and really kind of gauge how the kind of support that they need. So some days I just needed people just to come round to the house and just to listen to me offload about my treatment and my fears and my worries. So my mum was my sounding board, and I love her to bits. My mum had breast cancer 7 years ago. So she knew everything that I was going through. She knew all the treatment. We had pretty much the same chemo. She had the same type of cancer as me. So I was able to talk to her, but it was really nice to be able to talk to someone about like quite in-depth, morbid things. So when you're going through cancer treatment, you are scared of dying. Of course you're scared of dying. Who wouldn't be? Especially when you're reminded of it from other people about other people dying. But it was nice to be able to open up about my fears to my mom, and I wish I actually had more people that I was able to say, I'm scared that I'm going to die. I need to talk about it with you. And I very much sort of talked to my mum about the practical things, like what would happen to my son if I was to suddenly become really sick and die. Financial things. How was I going to pay for the house? How was I going to pay the bills? All that sort of thing. So it's nice to be positive and for people to come around and to try and keep you upbeat and take you out or cook your meals or take you out for dinner. That's really nice, to keep them positive. However, just be aware that sometimes they might need a lending ear, and just for you to sit and just talk to them about things that they're scared of, maybe. I had quite a few friends that they found that very, very, very difficult and would not enter into that. So if I try and raise any sort of fear, they would shoot it down with you need to stay positive. You can't go talking about stuff like that. You're going to be fine. Well, you don't know I'm going to be fine. I don't know I'm going to be fine. I'm scared I'm not going to be. So allow people to talk about that. So one of the things that I found most useful was actually just practical support. So I'm a single mom, my son was 10 at the time, and it was really, really helpful when people were like, well, can we take Harry out for the day? Can I cook you something? So people would drop food round. Even things like housework. My sister quite often would come round and do a bit of housework for me, and that was the kind of stuff that was really, really useful. Because quite often you don't have the energy to get up and do the hoovering or do the ironing or cook good food. So you do kind of tend to live on junk food that you just get out of the freezer because it's easy. Practical support is brilliant, especially childcare. So if you can offer that as a friend, that is fantastic. So this is something that I hear a lot as a cancer survivor. So there's a term we call active treatment. So active treatment is where you're going through your chemo, or you're having your surgeries, or you're going through radiotherapy. So that is active treatment. What I found is once my active treatment had finished, a lot of that sort of support and love dropped off. And I can understand it, you know, people view it as kind of almost taking a medication, and once you've finished with that medication, you're all better now, which is, you know, quite often the case if you have an infection or some sort of medical condition and you take your medication, it does make you better. And the active treatment does help to treat the cancer. What I found is once that had finished, you still don't feel like you are back to normal. And you have this kind of anxiety that stays with you for years and years and years and years. Even now, I still feel scared. I still feel anxious about it returning. So quite often I'll hear the phrase, well, you're all better now. Well, I am. I'm classified as no evidence of disease at the moment, but I still have blood tests. I had a scare a few months ago where I found a lump in my armpit. and they actually had to biopsy that. So I then had the anxiety, what we call scanxiety, where you had the anxiety of where you've had a scan and you have to wait for the results, because the first time you had to wait for the results, it was a bad outcome, which is why you were diagnosed. So there is always that fear that actually it's going to come back, and you do hear that a lot, where people have been, you know, clear for years and years, and then their cancer comes back. So I think that's something that never goes, but just be careful about making that assumption that, well, you finish your active treatment and you must be better now, because I mean, you're only as well as your last scan or blood test, I suppose, and there's always the worry that it's going to come back. Just make sure that you support people once they've finished their treatment, as well as when they're going through their treatment. Mental health is a big issue after you finish your active treatment. Quite a few people with cancer are diagnosed with post-traumatic stress. I felt that I had it. I wasn't diagnosed, but I definitely had it. Sort of flashbacks, anxiety, general feelings of, oh my God, I'm going to get sick again. And anything could trigger me. So just be careful and just look after your friend, relative, colleague once their treatment has finished, as well as during active treatment. So I hope this video has been useful about what to and what to not say to someone that is going through their cancer treatment. If you have any ideas for more videos, just pop them in the comments below. If you like this video, please like and subscribe, and I will see you again for another video. Bye.